Cervical cancer is a malignancy that affects the cervix, the lower part of the uterus that connects to the vagina. It predominantly develops from the human papillomavirus, HPV, a common sexually transmitted infection. Cervical cancer begins as abnormal cell growth in the cervix, which can eventually progress into a full-blown cancer if left untreated. A vaccine for HPV helps prevent cervical cancer in approximately 93% of cases. As always, these ideas are discussed in more depth in the book Cancer Self-Defense 101. Quick tips to help you survive. All citations for studies quoted in this video can be found in the book's bibliography at cancerselfdefense101.com. This video is intended as information, not medical advice. It is not intended to treat, diagnose, or cure any disease. Any medical advice should come from an appropriately credentialed medical professional familiar with your unique circumstances. Standard of care treatments for cervical cancer. The management of cervical cancer largely depends on its stage and the patient's overall health. The standard of care treatments for cervical cancer include surgery. In early-stage cervical cancer, stage 1, and some cases of stage 2, surgical removal of the cancerous tissue may be performed. This can involve removing the tumor, conization, or the entire cervix, hysterectomy. In more advanced cases, lymph nodes and nearby structures may also be removed. Radiation therapy. Radiation therapy is commonly used in combination with surgery or as a primary treatment for cervical cancer. It uses high-energy rays to target and kill cancer cells. External beam radiation and brachytherapy, internal radiation, are the two main types of radiation therapy used. Chemotherapy. Chemotherapy is often used in conjunction with radiation therapy in cases of advanced cervical cancer. It involves the use of drugs to kill cancer cells or stop their growth. Combination chemotherapy regimens are frequently employed. Targeted therapies. Some advanced cervical cancers may be treated with targeted therapies that specifically target molecules or pathways involved in cancer growth. Bevacizumab, or Avastin, for instance, is a monoclonal antibody that inhibits blood vessel formation in tumors. Approved medications for cervical cancer include cisplatin, carboplatin, paclitaxel, topotecan, bevacizumab, pembrolizumab, nivolumab, ipilimumab, gemcitabine, docetaxel, irinotecan, mitomican, etoposide. Because cervical cancer is not an immunogenic cancer, immunotherapies such as pembrolizumab, also known as Keytruda, tend to have modest response rates. For instance, Keytruda has a 17% response rate against early-stage cervical cancer. There are routinely developments for treatments in cervical cancer. One website to see promising medications for cervical cancer is onclive.com. Seriousness compared to other cancers. Cervical cancer is a significant health concern, but its seriousness compared to other cancers depends on several factors, including the stage at diagnosis and access to treatment. Globally, it is one of the most preventable and treatable cancers due to the availability of effective screening methods such as pap smears and HPV vaccination. In early stages, stage 1 and 2, cervical cancer is highly curable, with a 5-year survival rate of around 92%. However, in advanced stages, stage 3 and 4, the prognosis becomes less favorable, and the 5-year survival rate drops to about 57%. It's essential to catch cervical cancer early through regular screenings to increase the chances of successful treatment. Prognosis for stage 1. Cervical cancer. Stage 1 cervical cancer is localized, meaning it has not spread beyond the cervix. The prognosis for stage 1 cervical cancer is generally excellent, with a 5-year survival rate of approximately 92%. Treatment options, including surgery and radiation therapy, are effective in curing the disease at this stage. Prognosis for stage 4. Cervical cancer. Stage 4, cervical cancer is considered advanced as it has spread to distant organs or lymph nodes. Unfortunately, the prognosis for stage 4 cervical cancer is less optimistic, with a 5-year survival rate of around 16%. Treatment focuses on palliative care to manage symptoms and improve the patient's quality of life, but a cure becomes less likely at this stage. Support groups and resources for cervical cancer patients include Survivor, National Cervical Cancer Coalition, NCC, and Gynecologic Cancer Foundation, GCF. For more information, please see the book Cancer Self-Defense 101, Quick Tips to Help You Survive.